On today's morning show, we are grateful to have, courtesy of the Richland Hospital, in the studio with us, Ty Mulholland and Grace Denman, registered dietitians and certified diabetes care and education specialists. And we'll introduce you to a new member of the team, Kelly Herbert, who is a registered dietitian, here to talk about it. It's an important time because November is Diabetes Month. And good morning, Ty. How are you?
I am good, Phil. Thanks for having us on.
It's wonderful to have you here. As we talked before we went on the air, I heard your commercial, 35 years. How can that be?
I'm not sure. The math just doesn't work very well, but it is true. I've been at the Richland Hospital for 35 years.
You started when you were a baby, I guess.
Yes, I did. I was 12.
Okay. You were like a regular Doogie Howser then or something.
Wishful thinking, Phil, yes.
In that time, though, I mean, boy, things have changed a lot in your profession.
It has. You know, we used to vilify fat. We never used to have some of the technology that we have. We didn't have the broad knowledge and misknowledge. I don't know if that's a word, but you know what I'm saying. The information out there that's not correct in regards to health and wellness, and trying to sort through all of that and helping people actually find out what is evidence-based and, you know, what is a good option for them.
When you started, you didn't have to worry about the internet and all of the fallacies that you can find on there, too.
That is correct, yeah.
And so you're kind of, I'm guessing that's somewhat of a battle, too, where people are doing the WebMD thing or whatever and trying to find information at home. Right?
Absolutely. You know, you want people to be connected, but you want them to have the right information. And typically what we do as diabetes educators is have people start with the American Diabetes Association information. We encourage you to increase your knowledge base. And then as you explore a little bit further, you know, you have that good background to say, I don't know if that quite sounds right or not, but I can ask Ty or Grace and see what they think.
Grace, why do you think it's important to have a month set aside for diabetes and diabetes recognition?
I think it's important because there's many people who are at risk of developing diabetes. If it's been in your family, if you've had other factors such as having had gestational diabetes in your past, then you can have an increased risk of developing it. It's just a month to kind of bring awareness that this is an important thing that we want to manage. Diabetes that's left unmanaged can lead to many other health complications, kidney disease, eye disease, foot amputations if we're not watching our feet. And so bringing awareness, knowing your risk factors, and then making sure that you go to your primary care provider regularly to get screened for diabetes.
It's certainly not a death sentence, so to speak, if you get diagnosed with that, right? I mean, there are a lot of things that could be worse, right? Because this is manageable.
Correct. Diabetes is manageable. And when you come and see a diabetes educator, then we can help support you in making sure that we can find things that fit into your lifestyle to make sure that we can get that managed for you and lessen any of those risk factors that would come from the unmanaged diabetes.
Are you happy to have a new team member?
We are happy to have a new team member.
Let's bring her on here. Kelly Herbert, nice to meet you.
Nice to meet you.
Tell us a little bit about yourself.
Well, I've been a dietitian for 7 years and worked with people of all different ages. I started out with working with the WIC program for a few years, and then more recently was doing medical nutrition therapy and health coaching through a telehealth company, working with people getting to a healthy weight, improving their heart health, you know, lowering their cholesterol or blood pressure, and also a lot of people with diabetes and prediabetes, lowering their A1C.
So you were working like with telehealth patients, and this is more in person now at the Richland Hospital.
Yes, and I'm so grateful to be back in the world, in the real world. Not that that wasn't real, but I like seeing people's faces.
I was going to say, when you look somebody in the eye and you kind of have maybe more of a connection, don't you?
Yeah, of course, yeah. And I'm really grateful to be working with coworkers again, too. Like, that's a huge benefit, too. You know, I love seeing patients face to face, and I feel like we have more quality conversations and relationship, but also I'm really grateful to be working with coworkers again.
What attracted you to the Richland Hospital and that facility?
Well, I love the area, and I've lived in the area for a few years. I love the landscape, but then also I think it's really unique and inspiring that the Richland Hospital is independent and can do a lot of things differently because they're not a part of a big system. And I love the small hospital, like community, family kind of vibe.
Yeah, we talk about it, and one of the things that people probably don't realize is how many people that the hospital employs, but it's our county's biggest employer. But it's almost kind of like a high school in some ways, because you probably pretty much know everybody there that works there, don't you? For the most part?
Almost.
You're getting to know them anyway.
I'm still learning.
Well, you've been, we'll give you a break. You've, been on the job as long as Ty has, obviously. So.
Yeah, no.
But Ty, it's great to have somebody on the team again, and this probably gives you more opportunities as a staff, doesn't it?
It really does. We're all dietitians in my department, and Grace and I are diabetes educators, but we haven't been able to focus on the community's needs beyond diabetes. And with Kelly's onboarding, dietitians can see people with commercial insurance for nearly any diagnoses that's related to nutrition. So Kelly mentioned heart disease. It's the main killer of all Americans. We talk heart disease when people have diabetes, but we don't catch the people that don't have the diabetes because Medicare and Medicaid do not cover anything other than diabetes for us to see, and chronic kidney disease. So Kelly onboarding, her philosophy was, I want to see people with pre-diabetes because I don't want them to get to the point of needing you and Grace. She said it in a very nice way, but it's very true. We want preventative medicine, and so that's one of the things that Kelly is going to be able to offer. We have to carefully check insurances, and again, pre-diabetes isn't covered by Medicare and Medicaid, but it is by commercial insurance.
That's sad that you've got to jump through those hoops, isn't it?
It really is. It's disheartening.
Pre-diabetes, could you describe for us what that is, what that what that entails?
So basically, it's when your blood sugars are higher than normal, but not high enough to be diagnosed as diabetes.
Can we get rid of it?
Yeah, it's kind of an exciting point because there's a lot of potential to reverse it with diet and lifestyle changes. And if not reversing it, you can prevent the onset of diabetes by several years with diet and lifestyle changes.
So in your role, you can see some victories, right? I mean, that's got to be gratifying.
Yeah, I think that's why it's exciting and rewarding to me to work with that population specifically. They're motivated and you can have a high impact.
As Kelly said, we live in a beautiful area, but unfortunately, we have quite a few risks in Richland County, don't we, Grace?
We would have more risks, yes. Specifically, we don't have a fresh grocery store in town, but we do have the benefit of farmers around us. So we do have great farmers markets that we can still purchase things. But heading into the winter months, it's going to get a little bit harder for those fresh fruits and vegetables for us.
Indeed, yeah, and we've talked about that before, where it's actually not such a bad thing to get vegetables from a can and things like that, right?
Correct. The canned and frozen ones are just fine for us to eat and actually would have higher vitamin and mineral content than our fresh ones when we're shipping them across the country during the winter months. So they wouldn't be a bad option. The only thing that we'd want to watch for is the sodium content in some of the canned ones. So choosing more of the low sodium or no salt added options when we're looking at canned would be best.
Diabetes education. Maybe you can talk about, Ty, some of the things that you teach people.
Mm-hmm. It's not just the food. We start finding out who you are, what's important to you, what are your specific questions. Sometimes people think of education like when they were in school and you went into the classroom and this is what you were going to learn today because that's what the teacher had on the agenda. So with Diabetes Ed, we find out what's important to you. Maybe somebody will come in and say, I only want to talk about the food today, or I never want to talk about the food. And we're like, okay. And I want to know, I want one of those little gadgets that helps me check my blood sugars so I don't have to poke my fingers anymore. So we talk about continuous glucose monitors, the options. We spend a lot of time talking about insurance and coverage. I think that's a key thing to bring up during this time because it's open enrollment. People are looking at their policies for next year. We make sure that that, are your local providers covered? Are your medications covered? What is your expense truly going to be out of pocket? Not that we give specific information, but we give enough that where people might say, oh, I hadn't thought about that. So we encourage, people to explore their options carefully so that they can get the items that they need. We talk about activity. Are you doing activity currently? We look at where you're at, and maybe a goal that we would set would be going for a 5-minute walk. So we really try to set goals that are realistic and the person thinks they can do, and they're driven by what the person wants to do. We're not going to set a goal on something you don't think you can. So being really honest with us and open is a key part of the appointments because we want to help you. We're there to support you.
How important is it to maybe get out and do a 5-minute walk after every meal if you can, right?
Yeah, it's a very good thing to do. We people that do have continuous glucose monitors, it just checks your sugar every minute or every 5 minutes, and you can just watch the difference of what walking 5 minutes after a meal can do to a sugar. And you can eat the same meal and sit on the sofa and watch TV for 2 hours, and you can see the difference on what your blood sugars did. So they're wonderful tools. If you have them available to you. There's some over-the-counter options that we talk about. So it's really knowledge. We say knowledge is power, and it's kind of your choice then what to do with it.
How easy is it to get some of this equipment? Do most insurances cover?
They typically follow what Medicare does, which is if you take insulin, they are covered. Now, some commercial insurances will cover them without insulin. So, again, it's the checking the insurance sort of thing if you have diabetes.
Sadly, sometimes somebody will opt to not get treated because of the expenses of the medicine, though, right?
100%. We see that quite frequently. So then we explore the options. They said, I went to the pharmacy and this was going to be $900 a month. How do you expect me to do that? I'm like, we don't expect you to do that. It's often an unknown until you go and check out the price of what something is going to cost you. So then we explore other options. Or maybe your insurance covered a different brand of that particular type of medication. So we have to try a different one. So that's some of the daily struggles that we have is trying to get people what they really need.
Mm-hmm. So like there could be a generic brand or something else?
Yep, or sometimes they'll contract, it like with a vehicle, if a Ford versus a Chevy. Maybe your insurance company, has a contract with Ford but not Chevy, and we unknowingly order the Chevy for you, and I know you can't get that, but then we go back and order the other brand, and that one's covered. So we work on those kind of things. We do a lot of problem solving, as you can see, just based on this discussion. We set up goals and you come back and you'll say, nope, this didn't work. You're going to be disappointed in me. And I tell people, I am never disappointed in you. I just want to know why it didn't work. And you still think it's important for us to work on that. If not, maybe things have changed. We pick something else to work on that's more pertinent for that time. We spend a lot of time like this time of year talking about vaccines. It's not too late to get your flu and COVID vaccines. We really encourage everybody to get it, but especially people with diabetes because they can get sicker quicker. You're more likely to end up in the hospital if you have a chronic illness and get the flu or you get COVID. You may still get it if you have the vaccine, but it's not going to be as severe and you might not have to end up in the hospital. So
can vaccines throw your monitoring out of whack, though, or does it have any effect on that?
No, not typically. No, I haven't really seen that. Steroids can throw your blood sugars out of whack, so we caution people about that. I mean, if you had a significant reaction maybe to a vaccine for a day, your sugars might rise a little bit, but I haven't seen too much evidence other than that.
Grace, what about reducing risks? What are some things that we can do?
So when we're talking to people who have the diabetes already, we are going to talk about why we want to lower their A1C to their goal A1C. And that's the goal A1C is also personalized to the person. But the reason that we want that is that then we can reduce risks of other complications. Like I said before, unmanaged diabetes can lead to kidney disease, eye disease, heart disease, increases our risk of having a heart event. It can increase our risk of developing neuropathy, so losing that feeling in our toes typically is where it starts. And so we talk about how we want to do that. One, we want to make sure we're getting regular A1C checks with our primary care provider. Our primary care provider also wants to be checking our cholesterol levels regularly, our blood pressure. So we talk about the ABCs of diabetes: A1C, blood pressure, cholesterol, and making sure that those are getting monitored regularly, going to your appointments, seeing the dentist every 6 months, going to see the eye doctor yearly, seeing tie-and-eye, seeing your provider, and so that we can catch something if it does start to occur early on so that it doesn't become a bigger problem.
It's interesting. Sometimes, you have a family history, but sometimes there's no rhyme or reason, is there? Why someone gets diabetes?
It can be because there's many different things that can affect the diabetes. It can be partly lifestyle, but the biggest driver is the genetics. And if you have that in your family, we definitely want you checking in on if there's any progression with that diabetes.
When people give blood, is there a chance that they can be checked for diabetes at that time? Do they normally have a test for that?
Typically, the blood associations that are doing that are not checking for that A1C. It would be a lab test that your provider is ordering for you.
So you pretty much have to go to your primary to find it out then.
Correct.
So very, very good. Good information. We'll take a break and come back with more. We're talking about the National Diabetes Month, and our discussion continues in a moment on The Morning Show. Welcome back to The Morning Show on WRCO Radio. We have guests Ty Mulholland, Grace Denman, and Kelly Herbert here from the Richland Hospital talking about diabetes prevention and whatnot. Ty, one of the things we wanted to hit on was maybe a sick day plan if you have diabetes.
Yeah, we talk about safety with diabetes. We talk about preparing for different things, high blood sugars, low blood sugars, sick days. We kind of call those survival skills. And nobody wants to end up in the emergency room because your sugar got down to 30. We really want to prevent those things, or because your sugar got up to 600. So we spend a lot of time, encouraging people to know what the symptoms are of low sugars and high sugars, how to manage them if they occur, and basically how to prevent them. So it's not uncommon for somebody to show up in my office with a low blood sugar. And I'm saying, you weren't trying to impress me with a good sugar and overshot, were you? So, don't try to go to the doctor. Keep an eye on your blood sugar. A low sugar in the office is not a good thing. We treat it, obviously, but then we kind of try to problem solve about why it happened, and make sure you always carry carbs with you when you're out and about. Have them in your pocket, have them in your vehicle. In regards to sick days, I think this is a really good time to talk about it. It's the time of year we're starting to gather for things like Thanksgiving and holidays, but we share our germs during that time. And so again, your vaccines, making sure what am I going to do with my medications if I do get sick? Sometimes people think, well, I'm not eating, so I don't need to take them. And then they think, well, I'm too sick to check my sugars. I'm not eating anything. They must be fine. Well, being sick is a stress to your body, and it raises your blood sugars. So that's sometimes where we see blood sugars 400 plus is when people are sick. So we educate on that. Make sure you check your sugar if you're not feeling well. Do take your medicine. Be prepared if you go low or if you go high. Blood sugars are affected by so many different things, and sometimes you just never know which direction they're going to go, so you just have to check them, either with a finger stick or with a continuous glucose monitor.
Yeah, I would have never thought that they would go that high when you're sick.
Yes. And medication changes. I briefly mentioned steroids before, but we've seen people with blood sugars well over 400 when they're on steroids. So you really need, when you have a medication change, be a little more cautious and keep an eye on your sugars a little bit more closely.
What are some examples of good carbs that people can carry with them?
Glucose tabs are really easy and convenient because they never go bad. A lot of people like chocolate, but sometimes then you eat your chocolate when you really don't need to eat your chocolate because your sugar's not low, but it sounded so good. So glucose tabs aren't the tastiest things in the world, but they don't melt. They really don't go bad. They just get harder over time. You know, you can get little boxes of raisins that you could use. Sometimes I'll say 3 packets of sugar that you could nab from the restaurant. You can put in a little baggie. Don't just throw it in your purse. The paper pulls apart and then you have sugar in the bottom of your purse. But 15 Skittles, you know, some leftover Halloween candy, some leftover jelly beans. Those all make good treatments for a low blood sugar. Juice is great, but very often you're not in your kitchen when you have your low blood sugar. So sometimes juice is kind of hard to have around. But those are the things we talk about. We're like, oh, it's hunting season coming up. That's more activity than what you normally do. Make sure you have some carbs when you're out there in the woods because we want you to get back from out there in the woods. So those are the kind of the conversations that we have.
How long does it take from the time that, like, maybe you're experiencing some symptoms of low blood sugar to, you know, you ingest something? How long does it take for that to get back to normal then?
So if we use fast carbs, like those simple sugar things, theoretically your sugar should be rising in about 15 minutes. Now, for people that have experienced a low blood sugar, that is an agonizingly long 15 minutes because you don't feel good. You can get shaky and sweaty and weak and a little panicky about the whole thing. So a lot of times people overeat and they'll eat, we usually say about 15 grams of carbs, and people will eat a lot more than that. And then pretty soon now their sugar's 300 or 400. So you have to kind of sit and wait. The other thing is people have these continuous glucose monitors. It can take 30 minutes to show up on there because it doesn't measure your blood directly. It's measuring like the fluid in between your cells, and it takes longer from the food to get out of your gut into the bloodstream and then into those spaces. So 15 to 30 minutes, depending on how you're measuring it.
Interesting. And I'm guessing people that have had diabetes for a while probably can sense when things are changing, right?
Generally speaking, though, it's very interesting. If you run low sugars regularly for quite a while, your body gets used to it and loses the ability to feel that you're in the 50s or 60s. Normal's like 70 to 100 before a meal. So people that run low, you don't have now you can get down to 50 before you feel funny, and you're really in a danger zone under 40. So you've cut that range of when you can actually fix the situation. So when I work with people, I actually fix the low sugars first. They concern me more than the high sugars.
Well, Thanksgiving will be here before we know it, and that is the holiday for overeating, typically, Grace. And maybe we could give some tips on meal planning and some things that maybe we can spread it out a little bit over the entire weekend, right?
Yeah. So when I see my patients and we talk about some holiday planning, because a lot of them then tell me that they start to get anxious around this time because their sugars are looking good and now they're heading into that holiday season. We talk about still choosing the vegetable options that are offered at the celebration that you're at. You don't have to overfill your plate. You can always go back for seconds, so don't feel like you need super large portions on your plate. Stop when you're full. We don't need to eat way past that, where then now we feel like we have to unbutton our pants and sit around. The other big one that we talk about is the importance of movement after our meal. So instead of settling in and watching football, it is better for our blood sugars and just our bodies in general to move around. So maybe you say, hey, who wants to walk the block with me? Or maybe you offer to help clean up so that you are continuing to move around instead of settling into the couch with the other people who are. That way we can use up some of that sugar. We can use our muscles that use sugar when they're moving and kind of clear some of that out.
So the old fallacy is that turkey, puts you to sleep, but it's probably not just the turkey, is it?
No, it's probably the overeating that's just making us feel like a little more sluggish and tired.
I think you learn a hard lesson, because I've learned that a few years ago that I didn't feel well for about 3 days after, overeating, and so
Yeah.
it's not fun. We have to kind of tell ourselves that going into it. don't we?
Exactly. We tend to all have a stomach ache when we overeat, and it can last for a few days, especially if you're not a regular person to go every single day too. It can take a little bit of time for all that to work through. The other one too that we talk about is that my patient's on insulin. With holidays, you might be told that a dinner is going to be served at 2 p.m., but it's not always ready at 2 p.m. We all know that, right? And so if they have to take meal insulin, sometimes they'll decide, well, I'm supposed to take that 15 minutes before I eat, and so they'll give it at 1:45, and then 2 p.m. comes around and dinner's not done yet. The turkey's still not up to temp, and we have to wait a little bit longer. And then we risk going low because we already shot our insulin. So we talk about that too, that when we can't have a hand in what time the food will actually be served, giving your insulin when you have the food on the plate, so that we're not accidentally giving our insulin and then seeing a low in a bit.
Yeah, and the Packers play on Thanksgiving Day,
They
so
do.
people are going to be waiting till after the game, probably.
Probably,
So
yeah.
plan ahead.
Exactly.
Or have some hors d'oeuvres or snacks out,
Yep,
right?
a snack if you accidentally gave your insulin and now it's not going to be served, making sure that you do maybe grab a few of the crackers from the charcuterie boards and try and make sure we prevent that low from happening.
You bet. Well, let's talk a little bit about some recipes. We were talking off the air, Kelly. You were telling me about a sweet potato idea that you had, and you actually used it, right?
Yeah, several years. And I get asked to bring it most Thanksgivings. I think we've all had the sweet potato recipe that's just kind of floating in butter with lots of marshmallows on top. It's kind of similar to that, but much less butter and no marshmallows. It's diced up sweet potatoes in the same kind of casserole pan. Yes, there is butter. Yes, there is a little bit of sugar. But also dried cranberries and pecans, and that's basically it. And you roast it in the oven just like you would the traditional recipe, but it's just pared down to be more sweet potato forward and less butter and marshmallow.
Yeah. You don't want to be a party pooper, when you go to somebody's house, right?
No, everybody loved this dish. They were surprised at how sweet potatoes are just on their own. They weren't disappointed at all.
Right. So that's one of the things. Did you have a recipe experience you want to talk about, Grace?
Yeah, one of my aunts made us a sweet potato carrot puree kind of mixture. So she mashed up sweet potatoes with some pureed carrots. And then she put a little bit of cayenne pepper in it. So it was kind of like you had the sweetness from the sweet potatoes, but also a little spice to it. And it was great.
Well, it does. It sounds pretty good, actually. I think the last time you guys were here, we were talking about going to football parties, too, like football games. That's kind of a challenge sometimes, too, to find something healthy, isn't it?
Correct. Yeah, I think Lindsay and I talked about that before
that's
with
right.
you. But yeah, when you're going to a football game party, everyone just kind of says, bring your favorite snack. And that can be difficult to find things that are more friendly for people with diabetes. And maybe you want to be the one who brings the veggie trays, that you can have some of those vegetables, that the vegetables have that high fiber. They don't have the carbohydrates that raise our sugars, and it will balance our sugars from the other carbohydrates we ate. So maybe we want to do that, or also just kind of thinking more of like protein items, and then limiting ourselves to some of those carbohydrate items when we are eating.
Sometimes the vegetable isn't the problem. It's what you're dipping in, right?
I am still for dips. If that's how you're going to eat your vegetables,
Ah.
we just want to make sure that you're having your vegetables with dip and not a tiny bit of vegetables in the dip. Yeah.
Okay. More vegetables than dip, then.
Correct.
In other words. Certainly, this is a great opportunity to educate the public. And what are as you look down the road, some things that you want to maybe key on, or you want to talk about in your profession, Kelly?
Oh, geez, that's a broad question. I like to look at people like with their whole picture and the different foundations for good health. So yes, I'm a dietitian. We do end up talking about food quite a bit, but I also like to ask people about their sleep, how they're moving, their maybe sometimes finances or relationships, and because that can have a big impact on our well-being as well. So I enjoy talking about all the different like foundational health pieces,
Not just food.
not just food. Though I do like to talk about food too.
Well, we all do, obviously. And that's the thing with social gatherings, too. It's a lot of times it's all about the food, isn't it?
Yeah, it is a big thing that we gather around. And I think that's what's probably drawn us to the profession is like food isn't just nutrients. It's also culture. It's also family and tradition. It's a really important and fun part about life.
When you were back in school, did you ever see yourself doing what you're doing today?
Probably, yeah.
So it was what you wanted to be when you grew up.
I knew it was an option. I didn't really have a strict idea of what I was going to do. I just knew that dietitians could be in many different fields. Like I said, food touches everybody's life and in so many different kind of ways. So I knew that there was a lot of variety and options for what dietitians can do out in the world. So I definitely had this as an idea or possibility. Wouldn't say I was like, I knew it was going to happen or anything.
Looking down the road, though, it's probably, there are probably some things that we haven't even thought about in terms of, we just look at the last 10 years and all of the gadgets that are available. Have you read about anything coming up down the road here, Grace, that might be of
The
help?
big topic is the artificial pancreas, but right now we're not there.
Okay.
But we do have wonderful technology that, you're right, was not around, say, 10, 20 years ago, that's already allowing people with diabetes to have more management power on their own and to empower them to be more aware of how their food affects them, of how their activity affects them, and what we can do to make sure we get those numbers down.
Pi, I'm curious, you've been at this for a few years. Do you have patients that you're still seeing that maybe you saw back in the early days?
Oh, definitely. Yes. I still like paper a little bit. I have a list of appointments when people come in on a piece of paper and I'm like, oh, I've been seeing you 20 years now. Look at that. So diabetes education is an ongoing process. Like I said, I have a sheet of paper that says 42 things that'll affect your blood sugars. Well, obviously, you're not going to get it right all the time. Nobody can. My daughter, a lot of people know, has type 1 diabetes, and they'll say, oh, her sugars must have been really good. She's so lucky to have you. I'm like, we didn't hit it right all the time. She's a very active youngster. She was on swim team. We really had to learn that swim practice affected her sugars a lot more than swim competition, because of the adrenaline involved. We'd have highs during it. We'd have lows during the night. So, and everybody is so individual, which is why diabetes ed is so important. Because, again, everybody is different. And as your life changes, your sugars are going to change also. We know that as people, if they lose 5 or 10 pounds, often their sugars drop a little bit. If they conversely gain weight, their sugars often go up with more insulin resistance. We teach a lot with the new medications. When Grace was talking about overeating and Thanksgiving, I was sitting here thinking all of the GLP-1 medications that people are taking, the Ozempic, the Trulicity, the Mounjaro, the Zepbound. If you overeat with those medications, here's my safety caution discussion. Don't overeat on Thanksgiving because you may physically be sick afterwards. The capacity just isn't there. Definitely stop eating when you're full, when you're on those medications, or you can throw up. And you don't want to do that.
Not fun.
No, and you're there, just think about the gathering. You are there to see your family and friends. It's not so much about the food. We're surrounded by marketing all the time that wants us to buy more and eat more. And it just kind of think of it in that context, that isn't the healthiest way to do it. And we're gathering for different reasons.
How long before we feel full, though? Sometimes it takes a little longer to feel full, doesn't it?
Yeah. People that eat fast, and Americans are known for doing that. We're always in a hurry. We were trained from that at a school age. You only had so many minutes to eat your lunch or you're going to miss recess. So let's see how quickly we can gobble that food down. And we form that habit. Or we're busy at work and we're gobbling at our desk kind of thing. But it can take up to 20 minutes before your stomach says, oh, brain, you really should stop eating now. So eat slower. That's a technique that we teach. Savor your food. Don't gobble. Don't be the turkey on Thanksgiving. Just be cautious of your intake and keep that in mind. Enjoy the social aspect. Chat with those around you. Take in the whole picture.
Yeah, that's what happens when you put the phone down. You actually converse with somebody, right?
Yes.
Eat a little bit slower, perhaps. You mentioned your daughter, too. That's another aspect. Once in a while, I've read about pro athletes that deal with diabetes,
Yes.
and you have a whole new appreciation for somebody that makes it to that level and has battled that.
It is some fine tuning that goes on with that. You've always got your carbs as backup. These continuous glucose monitors are really wonderful things. But again, there's like a 10 to 15 minute delay in the information. So you really have to watch trend arrows. I've read articles like on Joe Jonas of the Jonas Brothers. He's not an athlete, but he's a famous singer, and it's kind of athletic when you're doing the performances for 2 hours.
Dancing and everything,
Yes.
right?
He's got somebody backstage watching his blood sugars every minute and having carbs available if he can run off between songs if they see he's trending down or not. So it's a huge learning curve. Especially when he has type 1 diabetes, that can often be a bit more difficult to manage than type 2.
So somebody off stage is monitoring it for him.
Yes, because he doesn't want to collapse during one of his shows, and that's kind of what we teach during Diabetes Ed. We don't want you to collapse while you're at your friend's house or you're driving down the road. So, we try to help give you the tools so those things don't happen to you.
Great. Well, it's really good information. Anything else any of you would like to add here today? Or did we pretty much hit all the topics you wanted to hit on today? Mm-hmm. Yeah.
We just want to wish you happy Thanksgiving to you, Phil, and the community. The Richland Hospital, we're very grateful for our community and how we're supported, and we hope we can always be there to support you.
The key is moderation, right?
Absolutely.
As we get toward the holidays, and for all of us.
Yeah.
Indeed. Thanks for coming in today. We have Ty Mulholland along with Grace Denman and Kelly Herbert from the Richland Hospital joining us to talk about Diabetes Month during this month of November.